Hello and welcome. My name is Isabel Sofia Diepa, pronouns she, her, hers. I am the engagement reporter at the Fresno Bee Education Lab. The Ed Lab, as we like to call it, includes 3 reporters and 1 editor. We work on reporting education stories in the Valley with a focus on educational attainment and solutions journalism. It's been 1 year since schools closed their doors and forced students to learn from home. The release of vaccines and increased testing has opened up conversations about how and when to reopen our schools. We have invited teachers, representatives from the California Teachers Association and the Fresno Health Department to ask some of your most pressing questions on the return to in-person learning and its safety. Our panelists today are Michelle Cush, a special education teacher at Clovis Unified, Heather Miller, a high school teacher at Fresno Unified, Manuel Bonilla, president of the Fresno Teachers Association. And once again, we'd like to welcome back Dr. John Zweifler from the Fresno County Health Department and our K-12 reporter, Monica Velez. Welcome, everyone. We asked you to submit your questions and concerns. If you were not able to submit your questions beforehand, not to worry. We will also be covering questions towards the end of today's show. So to be sure to leave them in the comment section if you have a question. Without further ado, let's dive into our first question from Monica Velez. Monica?
Thanks so much, Isabel. So this question can be for all of our teachers on this panel today, but I wanted to start with you, Manuel. What can parents expect from hybrid teaching?
Yeah, great question. I know that this has been a difficult time for all people. So let me just start with that. Thank you to the parents joining today. Thank you to the educators, both online in this show and then also that may be viewing. In regards to hybrid education within the Fresno Unified context is that it's going to be simultaneous instruction. And the reason for that is because you're really left with 2 non-ideal options. We know at other school districts, they're doing 2.5 hours of in-person instruction in the morning time, and then a 2.5-hour block in the afternoon time in order to get that social distancing that's necessary when we do return to in-person instruction. For Fresno Unified, in order to maximize the instructional time with a teacher and to also get that social distancing and all the other guidelines that are necessary, we went with a simultaneous model. So on some days a student will be in person and joining online. The other group will be joining online, and then vice versa the other days.
Thanks so much for that, Manuel. And I wanted to kind of pivot to Michelle. So since you've been on campuses teaching since last year, can you talk a little bit about some of the challenges that you've encountered that parents should be aware of, and a little bit about, how learning or how in-person learning right now looks very different than what students are used to?
Okay, thank you so much. So we have implemented the hybrid model where our kids do come the 2.5 hours daily. Actually, it's 3 hours because they come and so we have an hour in between for cleaning. Wednesdays is a online only model, and the reason that we're limiting some of that because we are limiting lunches, recess, times for interactions. I provide my services on the opposite times of where they're in person, so they're not being pulled out on top of their core instruction they're receiving. We also have a group that have chosen to be online only, and they are with a teacher getting their instruction that way. So we're trying to do our best to do our in-person instruction, our online instruction, and we are testing students in person for those who choose to do it. It is not a 7-hour day, and it's not the way it was before COVID, but we are trying our best to implement and get the kids back in school in the best way that we can.
Yeah, and I wanted to follow up with you. So, your teaching has had to be a lot more hands-on than some of the other teachers because you're an elementary teacher teaching special education classes. And so can you kind of explain some of those, safety precautions that have been put in place? How is that going?
Absolutely. So we do have all the PPE. We have N95 masks, the KN95 masks that we wear. We have face shields. Clovis Unified, which I'm very thankful for, had early access to the vaccines for us special educators and all of our staffs, including the IAs, to start getting their vaccines early. So I am now fully vaccinated. And because we do have to have close contact. When I do assessments, I try to do them outside. So limiting the contact because we have to be within that 6 feet when we do our instruction. And some of our aides have to be within 6 feet because of the needs of the kids. So we are using we have gloves available. So we have everything that we can to try to keep everybody safe.
Thank you so much for explaining that, Michelle. And it's back to you, Isabel.
Thank you so much, Monica. So this is actually a really great conversation talking about this hybrid model and a teacher teaching in person. I have a couple of questions for Dr. Zweifler on some of what can parents expect from like a health perspective. Dr. Zweifler, when do you think it would be safe for all students to return to school as normal versus a hybrid model?
Well, thank you for having me. And first of all, I'm thrilled that we have the teachers and Manuel Bonilla on this call as well, and that we're having kids return to school. And it's a big step, and I think all of us are concerned about making sure that we do it safely. So just to take a step back for a second, just to remind everyone how we got here. COVID is a virus. It's spread by respiratory transmission, which means when we talk or cough or sneeze or sing, that virus particles are spread. Similar to the common cold, we really do not have great treatments for the COVID. So really what we have to do is we have to prevent it. So we do have some tools for that. And one of the biggest ones is one that's been alluded to already is getting vaccinated. So if we can get vaccinated, we can keep from spreading the vaccine. So I think ultimately that's what we're going to need in order to return to normal. Until everyone is vaccinated, then we're looking at what can we do to prevent the spread of a virus that's spread through respiratory transmission. And I think all of you are familiar and have heard the things we need to do. We wear a mask and we socially distance. Those are the two biggest tools that we have. And that plays out in what's going on with the schools. So again, I'm thrilled that our kids are going back to school, but can do that safely. The hybrid model, I think, is a very reasonable way to do that. I think we'd all like to have our kids in school all the time, but it is really important that we socially distance. We keep 6 feet apart. That means smaller class sizes, having cohorts that stick together, so you're not exposed to as many kids. So those are all the mitigation strategies that we have to keep schools safe as they are. But it's really important that we not only think about the public health implications of COVID, but we do also think about the public health implications of kids not being able to socially interact with others and with their teachers. So I'm just thrilled that Fresno Unified, we're having the kids go back to school in the hybrid model. I think it's a fantastic step. Until we can get the majority of our population vaccinated, I think we're going to have to continue with these mitigation strategies of wearing masks and maintaining social distancing.
Thank you, Dr. Zweifler. And I did have a quick follow-up question. If teachers are vaccinated by April, if all teachers are vaccinated by April, do you think that it will be safe to hold in-person graduations or senior activities like prom this school year?
Well, so graduation is a hot topic right now. So it's around the corner. We'd like to all see some semblance of normalcy. So we've seen plans such as drive-through graduation, which doesn't sound like a whole lot of fun. The other big way that we can reduce the risk of transmitting COVID is by doing things outdoors. When you're indoors, the air doesn't circulate as well, and you're much more prone to being exposed to the virus. So the more kind of outdoor activities we can do, the better off we'll be. The state of California still has very stringent restrictions on gatherings. And so it's not entirely clear that we can do that yet. We expect more guidance on graduation in the very near future. You are seeing things like the state of California opening up Major League Baseball stadiums to allow attendance. My hope is that we'll also see expanded opportunities for us to gather at events such as graduation. So if they're done outdoors and with maintaining social distancing, using masks, I'm very hopeful that we'll be able to have some graduation that our graduates can feel good about.
Thank you, Doctor. And I have actually one last follow-up on this issue of vaccines. So we've talked about teachers, and we know that the governor has set aside vaccines for teachers. But will bringing more non-vaccinated students on campus put vulnerable students with autoimmune deficiencies in danger?
Well, that's why we have all these mitigation strategies. So first of all, when you come to school, you get screened to make sure that you're not having fever or cough or congestion or the symptoms of COVID. That's why we have people wear masks and why we maintain the social distancing. And that's why we need to continue to do that in our own lives as well. As parents, I think we can role model this behavior so demonstrate to our children why it is so important that you wear a mask and that you socially distance. For kids who are at particularly high risk, I think that there are options, including the hybrid model. We'd like those kids to be able to go to school as well. And again, if everyone is following the safety protocols, they should do well. So it's a matter of being consistent, and that message starts with us as parents. But I'm confident that we can and we have open schools safely with very little transmission. So it's not a time to let our guard down. We need to continue to wear masks, socially distance. And then our children who are more prone, I think, also can participate. We do encourage, if you do have a significant medical condition that puts you at higher risk, to talk to your doctor about what are the best options for you. And so there's a variety of special situations. We have Michelle here, who's a special ed teacher, and so you get a number of situations with kids with special needs where you have to have a more nuanced approach. So it's not one size fits all. Personally, I'm thrilled that we have the hybrid option, where we have both online opportunities as well as in-person opportunities for schooling. And I think that's really where we need to be to meet the needs of the greatest number of our children, while making sure that our teachers can feel safe at school as well. And just one other word about the vaccine. I have to do a shout out to Fresno County Department of Public Health. I haven't been as involved with the vaccine rollout, but it's my understanding that all teachers in Fresno County will have access to the vaccine by the end of this week. And it's been a very kind of disciplined rollout of the vaccine to highest risk groups. It's really tough choices. Do you give it to your grandma first? Do you give it to someone who has emphysema first? Do you give it to the person working in the checkout line at the grocery store? Someone working next to someone else at the meatpacking factory? Someone in a congregate setting in a homeless shelter? And our teachers. So just some really tough, difficult choices. We're in a much better place today than we were just a couple months ago. So I'm really very optimistic about the future.
Thank you, Doctor. I really appreciate that. We want to go back to asking some questions to teachers. So I'm going to toss it back to you, Monica, for some of our teacher questions.
For sure. Thanks, Isabel. So this next one, I want to ask you, Heather. Thanks for being with us today. And Heather is a high school teacher for Fresno Unified. And so, we know that not all parents are sending their children back to hybrid learning. And especially for, older students, high school students, it might take a little longer depending on the district that you're in. And so what are some of the things that you have learned about distance learning over the last year? And what kind of improvements have you made, kind of some trial and error stuff?
I think engagement's been difficult, right, in this environment, because students can sort of turn on their computers and walk away and go do other things. So trying to find things like Nearpod and other interactive platforms where students are constantly interacting in some form has definitely helped. And then just a lot of reaching out to students one-on-one. I will say, kids love to text, and I have seen pretty good response through messaging. They meet with me face to face, but they will often respond, at all hours of the night. Sometimes I get messages, but they are responding definitely through that. So I think it's been a lot of reaching out individually to students when I see that they're logged in, but they're not participating on things like Nearpod. I can track that pretty fast and say, hey, what's going on? How are you doing? And try to resolve whatever issues are, keeping them from being able to fully participate in the online environment.
And Heather, can you also talk a little bit about what your workload has looked like since the pandemic started in March? I've talked to a lot of teachers about this, but I don't think, sometimes I feel like maybe not everyone really understands what kind of learning curve, what kind of work you teachers have had to put into this.
Yeah, it's been a 7 days a week kind of experience. I know a lot of people think like, oh, well, you're working from home and you'll have all this extra time. And but we were never trained to work in this platform, number one, right? And technology wasn't ready for us. And so there was a lot of trial and error those first few months. There was a lot of time. But even now, when I create a lesson, I've been teaching for 10 years. I'm pretty quick at being able to create lessons, but now I have to think about delivery in a totally different way, and then convert those lessons over to a digital platform. And so it's like I'll have a lesson ready, but then it's got to go into Nearpod, and then I've got to think about how am I going to, in this setting, get people to interact, which is completely different than anything I've ever experienced before. So I know for me, I'm working 7 days a week, especially because a lot of us are getting headaches and things like that after being online all day. My back hurts. Like I've never sat all day before that, so I wasn't really physically prepared for this kind of work either, in an odd way. So I'm having to take breaks. I'm having to work Saturdays and Sundays to sort of break up that online time. And the other big element I know for high school, and I can't speak to elementary school, but I'm assuming they're having some of the same things. Everything's being done digitally, which takes time to load. So what used to take me, half an hour to grade is taking me an hour, so between lesson planning and converting lessons and then grading, and then also the efforts we're putting forth to like interact directly with students who aren't participating, right? It's just been nonstop. It's my life. And I've got kids, and all hours of the night. A lot of high school students want to work, late at night, and you try to have some boundaries, but you care about kids. And if you've got a kid hasn't been doing well and they reach out to you at 8 o'clock on a Saturday, you're going to respond. So it's pretty much permeated our whole lives.
Thank you for explaining that, Heather. And Michelle, I wanted to come back to you, and I wanted to talk. I wanted to see if you can talk a little bit about some of the challenges teachers face when it comes to simultaneously teaching online and in person, which I know is something that you've been doing right now.
So luckily I've been doing this a long time, but this like it was said before, this is a whole new platform. So you really have to relearn and be flexible and realize that you're going to make mistakes. So I have myself scheduled basically for times where I'm going to be online, times where I'm going to be in person. So every basically half hour of my day is taken up. So there is not that flexibility. I also have an instructional assistant. So between the both of us, we see all of our kids throughout the day. We do our testing and everything goes on. And you become very flexible quickly. I mean, I think the pandemic has taught us all, and most of us who are educators are a little bit type A. We like, to do things and we like to do them well. Well, we've had to relearn and we've had to learn flexibility. And just like our kids have, we see some of the struggles they go through because we've gone through them also. And so in some ways, it's been a little bit of a blessing because we've developed closer relationships because we're all going through it together. And I have to do a shout out to my parents that are helping out with the children that are online. They've done an amazing job of supporting their kids. And it has been a little bit of a blessing having them come back in person because a year away from school is a long time for anybody. And our kids were starting to feel a little bit of, being isolated and having those options of coming back or doing the simultaneous where they see their peers or gives a little bit of an outlet and things to look forward to. Like the doctor had said, maybe our future is brightening up a little bit. And I sure hope so because our kids really need it.
For sure. Thank you for that, Michelle. And Emmanuel, I want to pivot to you. So with all the discussions around equity right now, what can you tell us about how kids from disadvantaged backgrounds are adapting to the hybrid model and distance learning?
Yeah, we think that obviously one of the big things throughout this entire year is just the realization that we're all going through this together, and obviously there's an equity issue to that as well, right? I know that one of the things that we made sure of in the springtime is that all of our students had access to technology, had access to hotspots. And yet that, obviously there's still some equity issues that are involved with some of this. I think what it's done, though, is that the thing that I hope that we all take away from it, particularly in the education system, is that those equity issues existed prior to COVID. And hopefully that the COVID magnifying glass has been put on education will allow for policymakers, allow for decision makers at the local school districts, wherever that school district may be, to really hone in on the idea that many of the things that take place outside of the classroom impact the things that are going on inside of the classroom, right? Because that's what we're seeing. I know that there's been a lot of talks in regards to different achievement rates, whether it be grades or whatnot. Again, that's because we're all going through this pandemic, right? There are probably households that are experiencing a number of issues that are going on in their household. And so how we address that is a community lift, is not just an education lift. And again, I hope that as a community, as a school system, that we see that it's beyond any school district. It's really working in collaboration with the city, working in collaboration with the county to set policy that is going to set our students up for success in the classroom.
Thanks, Manuel. And I also want to follow up with you. So you're also a parent and have had kids who have been distance learning, this whole time, while you and your wife, are also have full-time jobs. And so do you think it's feasible for working parents to drop kids off at school for only 2 hours a day? Like, what are your thoughts around that? What have you been hearing? Especially since a lot of other teachers also have children.
Yeah, that's a great question. It's one that we're tackling right now. I'll tell you right now, we're having that conversation in regards to childcare. It's one that we have to address in my own household, right? A 2-educator household, 2 school-age children, right? And then an additional child with childcare. So how do we navigate all of that? Again, it really speaks to my point that we're all in this together. I would have loved to have seen a regional approach, particularly in the 4 large school districts, within the Fresno area, Sanger, Central, Clovis, and Fresno Unified. I think it would have been a better way of tackling this. Because we're all in this together. And I think that in Fresno Unified, we try to take a collaborative approach on that. It is a question that our concern, that we are trying to tackle, because the reality is we have to, based off of the guidelines, adapt the instructional model, right? It's not going to look like a full day that we're typically used to. So we have no other option other than to throw out the guidelines completely and just say everybody come back as normal. And I don't think Dr. Zeifler would appreciate that. I don't think members of our community would appreciate that. It's a difficult circumstance for sure. It's one that many people are going through. I know in my house we're going through it, and I'm going to do my part in Fresno Unified to address that issue so that way it is resolved.
And Heather, so you also have children, and
Yes.
what have been some childcare options for you? And once you start teaching in person, and what have you been hearing from your colleagues?
I'm lucky, and I'm in a unique situation in some ways. My kids are a bit older, But so I have that going for me. But I do have 2 children that are adults with disabilities, and those programs aren't open yet. So for those of us with that are caring for children with disabilities, whether they're school age or after, in my case, you know, the school age programs will be opened up, but like young adult programs might not be. So and either way, even on these modified schedules, if you have a child with a disability, there isn't, just, you can't necessarily just drop them off with grandma or an aunt, or, there aren't a lot of people necessarily trained and willing and capable of providing that. So, I mean, I'm lucky I have a college age daughter who is home and she's online, learning here. And so she came home to do that. And so I'll have her support. But if not, I would have had to take leave because their dad is both both of us are educators. One of us would have had to take leave. And I am afraid that that's what we're going to see. Like, there are going to be a lot of teachers that are either going to have to start using some sick days to figure this out or take leave, which then is going to impact instruction even more than it currently is, right? Because then there's going to be subs and we're not going to be as available because they're just not going to have anywhere to take their children. So I think that's something that's hopefully we're going to be working out in the next few weeks.
For sure. Thank you, Heather. And Michelle, I wanted to ask you a little bit more about what you've been seeing in your classrooms. How have your students' mental and social and emotional health been affected by hybrid learning or just, distance learning in general?
I think that with regards to the hybrid learning that we've been doing, the kids that have chosen to return have been doing well being back. They're happy to be back. Even though it's not their regular day, they're out and they're getting interaction and those social emotional needs. We had some children that when we couldn't return, were only doing distance learning, and some of those were really struggling with their social emotional needs. And since they've returned, it's getting better. I find that we are doing some more assessments, especially with our upper grade kids, 5th and 6th grade students that are still doing the online options, whose families, for whatever reason, have not chosen to come back, that we are seeing some needs and some referrals from their parents because they don't see the same child as they did before. So, when we look at education, we have to look at everything, including their social emotional needs and what school provides for that. And we really have to look at the whole child. Our needs are secondary to what our students need. And so it's important, whatever the parents choose, whether it's online school or a hybrid, that we're there for them and we can help through this difficult time. I have a 15-year-old who went from strictly online to now she's in high school. She's doing the hybrid model and starting next week. They're back to 4 days a week. And so just speaking about her, she's much happier being back at school with her friends, even though she has to wear a mask, even though she has to social distance. There are certain needs that we really have to look at with kids and their social emotional health.
Thank you so much, Michelle. And I wanted to go back to Emmanuel. I think you wanted to add something.
Yeah, for sure. I'll just dovetail off of the previous comment, and then talk a little bit more about the childcare issues. So yeah, there's definitely multiple needs, and I think that that's one of the things. Kind of going back to my global comment that we're all in this together. Where how do you manage a global pandemic, right, with all the various stakeholders, all the various needs? And so just making sure that the community knows that there are multiple needs throughout the community. The need that we were talking about in regards to the childcare, that does have a ripple effect, much like Heather mentioned. She may be fortunate enough to, have another person that may be able to take leave, but then that's, obviously an unfortunate component to that. But then it's not just teachers, right? It's everybody throughout the system, particularly in Fresno Unified, when we're talking about the Valley's largest employer, 10,000 employees, and the impact that may have, not just within the system with our bus drivers, our staff, office staff, and all the other employees, but then if we, obviously, if we're able to get all the childcare, then that ripple effect is that maybe others are not, because there's not enough supply of childcare providers at this time, right? So just making sure that people understand that there are ripples in all of the planning that goes along with reopening schools.
Thank you for that, Manuel. You made a really good point there. And Heather, I did want to ask you a follow-up question. I asked Michelle a little bit about her experience with simultaneous teaching, but I wanted to ask you to kind of get that high school perspective on how that's going to work. So if you can explain that a little bit more for us.
Yeah, we haven't done it yet, but in our situation, we're looking at essentially being, I think it's important that people know that students, what it means to simultaneously teach. I will be teaching online the same time students are in the room. So essentially, if your student, I think it's important for parents to know, if your student chooses to come back, they'll be in a room with me and we'll be socially distanced and all of those things. However, I still have to teach online, right? Because I have at least another 20, we'll have as many as 10 kids in a room for safety. And then I've got 27 more kids at home online at the same time. So I will need to be simultaneously teaching, which means I'm going to have to be online for the most part. So students, will be in the room with me. And I do think, there are social emotional issues here that this could help with. I think that there are kids that are really struggling with time management, and that coming to school will help with that. So there are benefits still for students that do choose to come back. But I do think it's important that the parents understand that we will still be teaching online, and that for each individual family, you have to weigh that risk, right? We're going to do everything we can to be safe and to mitigate that. But we know young people aren't necessarily always going to social distance, particularly outside of our rooms, when they're walking to classes. And we're still concerned about ventilation. I'm going to be honest, I teach in a little portable, and there's, and their Fresno Unified is going to try to address those needs as well. So I right now polled my students last week, as these new plans have rolled out. I only have about 15% of students that want to come back under these conditions. I think that might grow as their friends maybe start to want to come back, but most of them have said that even though they want to come back and they miss being together, that there's still a risk to their families for many of them, because of grandparents and parents that aren't vaccinated yet, as well as they're like, well, if I still have to learn online, I'd rather just do that from home than go through all of that too. So I think each individual family, it's really important that parents kind of know what that's going to look like, particularly for the high school level, because that's what I could speak to the best, and weigh those factors of mental health, of time management if kids are struggling with that, and versus, the risks.
For sure. Thanks for that, Heather. And I guess kind of pivoting off of what you were saying about, being in a portable and air ventilation being an issue. Manuel, can you talk a little bit about some of the efforts going on at Fresno Unified right now?
Yeah, for sure. I could definitely talk about some of the global things. I'm sure Dr. Zeifler or maybe somebody else would be able to give a little bit more of the actual scientific details of it. But according to CDC guidelines, the MERV 13 was the MERV 13 filter was the filter that provides the maximum protection for COVID filtration. And so we know that the district is working to install that where that's available. In addition to that, they are also working to get an air filtration device. And then in a past public town hall that we did, we showed a picture of this. So each of these classrooms should have this filtration device installed in that. So just kind of, again, our approach has always been about layering the mitigation factors.
Thank you for that. And I'll pass it back to you, Isabel.
Thanks, Monica. Thank you for all that information, guys. That's super beneficial. I know that a lot of our viewers had these types of questions. So I want to get further into teachers and vaccinations. And this is for Dr. Zweifler. Currently, how many teachers have already received one shot of the vaccine? And what is the plan in terms of a timetable for vaccinating all teachers who want one?
Boy, I don't have the exact number of teachers right now, but I heard Manuel say in Fresno, the Unified School District alone, you have 10,000 employees. But it's my understanding that 40,000 vaccines have been allocated to get all of the teachers in Fresno County vaccinated here in March. And my understanding is that we're ahead of schedule, and that all teachers will have been offered and given an opportunity to get vaccinated by the end of this week. So we're ahead of schedule for all 40,000. And yeah, if there's any teachers out there and or parents who may be eligible for the vaccine, just to really encourage everyone to get the vaccine. So it's been an incredibly difficult year for all the reasons that all the other panelists have talked about. I can't remember another year that's been as difficult and trying in so many ways for us as individuals and as a society. Again, there's no effective treatment. The way we do it is we prevent it. The vaccine is our way out of this pandemic, and we're getting close. So there's no contraindications for the vaccine. It's been incredibly effective. If you are not vaccinated, your chances of getting COVID are 20 times as high as if you are vaccinated. So it's incredibly effective. Every one of us should, if given the opportunity, I really should strongly encourage you to get the vaccine for yourself, for your family, for your school, and for your community. It is our way out of this pandemic, and I'm just so pleased that we've been able to offer the vaccine to all of the teachers here in Fresno County, and by the end of this week, all of them will have had an opportunity to get vaccinated.
Thank you. And I had a follow-up question, Dr. Z. What is the timeline for students to get vaccinated? We know that, we're trying to prioritize teachers, trying to prioritize essential workers, we're trying to prioritize the most vulnerable, but youths and adults, what's the timetable for them to be able to get vaccinated?
Okay, well, good question. So the vaccines have been tested in adults. They have not yet been tested in kids. So, we fully expect that to happen. We've got other types of vaccines, and measles and mumps, rubella, et cetera, that we do offer to children. So we know that vaccines can be very safe and effective for our kids. But the COVID vaccine has not yet been approved for use in children. So the Pfizer vaccine, you can give it to as young as 16. The Moderna, I believe, is 18. And Johnson & Johnson, 18 and above. But they're definitely working on that, and I would expect within the next 6 to 12 months that we'll have the vaccine available for our kids as well.
Thank you, Doctor. Well, I'm going to shift it back to Monica because I know that she has a couple of vaccine questions as well. Monica?
Thanks, Isabel. And yes, I do. So Manuel, I wanted to start with you, asking you about some vaccines. So, as we know, school districts have said they aren't requiring teachers who are teaching on campus to be vaccinated. Can you kind of talk about that and explain a little bit of why that is? And what kind of plans are in the works if a significant number of teachers don't want to be vaccinated?
Yeah, so the approach, I'll give a little bit of context, and I can only speak for Fresno Unified, or our part within Fresno Unified. When we talked about the orange tier all the way back in November, that was because it was the idea, again, this multiple layers of mitigation factors. And then again, with the idea that it was a community effort, right? The orange tier would mean that as a community, we've done the things that we need in order to stop the community spread, or at least lessen it. The game changer in this case, as Dr. Zeifler has mentioned, is the availability of vaccines. So with that, it's kind of another tool, another safety mitigation. Superintendent Nelson has worked within the Fresno Unified context to partner with Valley Children's to make that available to everybody. That they had an event last Saturday, and that will be available to all of Fresno Unified employees, so all 10,000 employees prior to return to in-person instruction. It's not something that we agreed to in regards to requirement. It is something that is voluntary in regards to that, and so really it is going to be up to that individual's decision. I don't feel comfortable in regards to making medical decisions for somebody, whether or not they're going to take a vaccine or not. Because it seems like that would be something that, in regards to where they feel is comfortable with as far as the vaccine goes. There are going to be other multiple mitigation factors. And then, obviously the antigen testing that's going to take place as well.
Thank you so much for that, Manuel. And I also wanted to follow up with you as we start taking some questions from the viewers right now. There was one on Facebook directed to you, Manuel, from Marcelino Valdez Jr. And he says that there is a rumor circulating that Manuel and other admins from FVOSD have their kids back in person classes, but they are keeping Fresno Unified School District students home until Fresno returns to orange tier. Can you kind of explain if there's any truth to that rumor? And
Sure.
I guess just kind of clear that up for some of the people who have conflicting information out there right now.
Yeah, for sure. I believe the gentleman that made the comment is the person that started an online group to reopen schools. And what I want to be clear as to what they're really asking. What they're really asking is to ignore the CDC guidelines and open as if we are not in the middle of a global pandemic. And to specifically answer in regards to this rumor, it's unfortunate how this health crisis becomes so politicized. Absolutely not. My kids, when this comment was made, I clarified on social media as well. Actually, a reporter asked me this question. My kids have been in distance learning since the very beginning of this, about a year ago. So it's unfortunate that people would politicize, number one, but then try to utilize kids in order to politicalize this situation. And then, there's so much misinformation in regards to a plan to go back with a lot of this. So that's very unfortunate to see, particularly as, again, we're all going through this together. How might we approach this from a community perspective?
Thank you for clearing that up for the audience right now. And so I know we have some more questions from the audience. So I'm going to go back to you, Isabel, to ask some of those.
Thanks, Monica. Yes, and so some of you guys submitted your questions beforehand, and some of you are submitting questions now. Please feel free to submit some live questions. We're going to try to get some live questions, and we're going to ask the questions that people submitted beforehand. So we actually talked a little bit about ventilations. Erica Ireland had asked a question specifically about portables and ventilations, which I think you guys covered. But she has a second question, which she was told with the reopening permits that they were allowed by the state of California to open schools allows for only 4 feet of physical distancing rather than 6 feet. Is this true? I'm going to ask Dr. Zweifler if this is something that you have heard about from the state and the health department.
Well, the state reopening guidance does reference the possibility of going to 4 feet if you've exhausted all other options to provide education for your educational opportunities for your kids, and including things like outdoor education and offering hybrid education models. So we've heard some of the teachers referred to the number of kids who want to come back to in person. Parents have mixed feelings about that. The way I look at it is, it's been a really hard journey. I'm so excited that Fresno Unified is going to have a lot more kids going back to school. So we're kind of on this journey. You don't go from 0 to 60 in no time flat. So we should do this in a careful, thoughtful, structured way. So let's get our kids back in a safe way, using masks, socially distanced, smaller class sizes, hybrid learning, and capitalize on the opportunities of what you can do when you're teaching kids in smaller classes, and give our teachers the resources that they need to do that well. And as we get more people vaccinated, we find that things are going that things continue to be safe, as we have seen so far with several of the school districts that have reopened using these safe smaller class sizes and masking. We have not seen outbreaks with that. So let's roll that out on a broader scale. Let's get people vaccinated, And then as we find that this is working quite well, then yes, down the road, you ask, when do we get back to normal? Well, yeah, at some point, then maybe we start to look at if everything goes smoothly, we think, okay, maybe we can reduce the distances between the students. But to do that right out of the gate, I think it would be really a poor decision. And starting again, let's think about why do we get COVID? It's a respiratory infection. It's spread by coughing, sneezing, talking. If you're close to somebody, you're much more likely to get it. So let's be smart about this and do it in a gradual phased process. So I expect that over time, and that I do fully expect that we'll be able to reopen more and more schools safely and at different grade levels is the other big one. And as we demonstrate that, then yes, I think we will be looking at being able to have kids closer together. I question whether it's even needed at this point. How many parents really want their kids to be back full time in a setting where they're close to others? I suspect that a significant number would prefer a hybrid model or distance learning, and that the demand is not there where you have to seat kids 4 feet apart. So yeah, I feel much more comfortable with continuing to apply the basic mitigation efforts, masking, social distancing, screening. Let's do a good job with that. And then as we have success, then we think about what we can do to have more kids back in the classroom.
Thank you, Dr. Zeifler. So this question, I know that Manuel, you're going to leave us in a little bit here, but I did want to ask a quick question to you. What happens to teachers and students who cannot return to the classroom in person learning safely?
Yeah, great question. So I'll start with the student seat first. So Fresno Unified will be asking, about who is going to want to return, much to Dr. Zeifler's point. Right now, I believe that they are utilizing an 80% model, which is actually very high. We're seeing that in other school districts, at least according to the data that was provided by Fresno or some projections, I should say, by Fresno Unified, that's actually a pretty high number. It's probably going to be trending a little bit lower. I could tell you at my kid's school, the number is around 70%. People will have an option, right? All that to say that parents will have an option whether or not to send their student back to in-person instruction, okay? And then obviously following all the different mitigation factors. From the teacher side of things, if a teacher is not able to return because they are on some type of a high-risk category, then they would need to go to a doctor to obviously verify that. And then they would go through something called the ADA process, and they would have some type of accommodation for that.
Thank you, Manuel. And I'm going to take a live question. This is from Mary Rivera. And I'm going to open this up to the floor, but I'm going to direct it to Dr. Zweifler first. What about children playing in playgrounds during recess and lunchtime in the cafeteria? What type of social distancing will happen then?
Well, it's the same basic principles. So you spread it by coughing, sneezing, talking. Kids, unfortunately, we can't get them vaccinated yet. So there's definitely the risk of transmission. We know that it's lower in kids, but it exists, and kids can get very sick, and kids have died from COVID. So we need to be careful. Outdoors is certainly safer because of the ventilation factors, but the same basic principles: staying 6 feet apart. Wearing a mask are things that we would continue to encourage. As far as cafeteria, that's a really high-risk area. You look at what the CDC has done studies on where people most likely to get COVID, and the answer is indoor restaurants. So that's basically what a cafeteria is. So you take your mask off because you're eating. So it's a chance, and so that's a real good chance for you to spread the virus when you're talking or speaking with your friends. And so there's a tendency to sit closer, and so cafeterias you have to be really careful about. And so when we think about reopening and gatherings and guidance, graduations, things like that, one of the elements that we look for at the Department of Public Health is that you pick up your food, you eat, and you maintain social distancing where you're eating. So cafeterias are a particular hotspot where we have to be very very careful.
Thank you.
Sorry, I can just state that since we do have children in person, the reason that we did the model that we chose was to eliminate recess, eliminate PE, and eliminate lunch, where we considered those high areas of potential interaction. And so far, so good. It's working well. We definitely make sure that all the kids before they enter have gone through the checklist and the temperature checks and have clearance. So that's how we're doing it at the elementary. I'm not sure how that would work at the high school or what the plans are, but that's what we're doing, and it seems to be really mitigating those issues.
Just
Thank you.
one
And
comment
Manuel,
about that. I was just going to say, in terms of recess, we really, in terms of maintaining your health, and so we don't want you to get COVID, but we do want people to stay physically healthy. We've talked about mental health, which is so important, and the social element of being in school, but physical health is important too. We really encourage everyone to get outside, be outside, stay physically active. If you're 6 feet apart, the CDC guidance, if you're in the park and places like that, if you're more than 6 feet apart outside, that is a safe activity. So we really encourage physical activity, and we should encourage our children to be walking, jogging, bicycling, all those types of activities. But doing it outdoors and wearing a mask when we're doing it.
thank you, Dr. Zeffler. I don't mean to interrupt, but I just wanted to, I know that Manuel said that he was going to say something in regards to how this could work for FUSD. I don't know if you have some quick time, Manuel, to be able to answer that question.
Oh, I'm sorry. In regards to the instructional minutes, that's the question I think I saw in the little timeline there.
In regards to recess and cafeteria time.
Oh, yeah, for sure. So there is some break time that is embedded in there. We do have at Fresno Unified, there's additional staff in regards to not just the teachers, right? And so that is something that obviously they would have to do from our conversations with the district. And that is, just want to be very clear, that's not something that is in our role, that is something that is in the district's role, but they know that they have to follow the guidelines, and then they'll be able to provide that time in a way that is safe and structured, without completely eliminating those types of things. Will it look the same? Absolutely not, right? Obviously, you can't look the same with the guidelines, but that is something that the district will manage. And again, I want to make it clear that's something that is on their responsibility to do.
Thank you, Manuel. I appreciate that. And I have another question that we actually have here in the chat that Heather brought up, which is very valid. And I'm going to direct it to Dr. Zweifler. What happens if someone does get COVID on campus? What are the protocols or recommendations from the health department?
Okay, well, that we take that very seriously, but I have to say that to date we have had very few incidents of transmission on school campuses. The vast majority of cases that we've seen, and there haven't been many, are related to individuals who become infected off of school campus and are then detected through screening, or they inform the school that they're positive. There's only been, as I'm aware of, a single situation where there was a transmission of amongst employees, but otherwise we have not seen incidences of student to teacher or teacher to student transmission. If there is, all cases are reported to the health department. We then follow a contact tracing process, and so we work very closely with the school nurses, and in fact we've been meeting weekly with the school nurses from all the school districts, and it's been a very good kind of two-way discussion about what works and what doesn't, the PPE issues and things like that. But if there was a case, we'd go through a contact tracing process. And contact tracing involves identifying any individuals who are considered what we call close contacts to the person who is infected. Close contact is anyone who, again, is within 6 feet of someone else. So again, that 6 feet, that's why we use that 6 feet barrier, because that's where you're most likely to encounter the respiratory transmission of the virus. And so if you maintain your classroom, you keep the kids 6 feet apart, and then you're not going to have as many close contacts. If you do identify close contacts, then those individuals would be asked to that would be told that they would need to stay home and quarantine for 10 days. So also, if you're a household contact of someone who is identified as being positive, so say if you have a sibling who is in school and you're positive, then that sibling would be asked to quarantine as well. So if you're infected, you isolate for 10 days. Anyone who's considered a close contact, i.e., is it within 6 feet for more than 15 minutes over the course of a day, then they would be asked to quarantine. So we've worked closely with the schools on identifying close contacts, and it's again another reason why we really push that social distancing, smaller class sizes, staying in stable cohorts so you're not infecting a large group of people at school. And I know we're running out of time, but the huge issues around this with things like sports. It's particularly sports where you have close contact, and which is why we're adding an additional layer of requiring testing in those situations. But the close contact sports, the football, basketball, wrestling, extremely high risk sports, and we want to make sure that there's testing that's going on when that starts.
Thank you, Dr. Leffler. Michelle, I see you were nodding your head. Did you want to comment on this as well?
Well, I feel like I'm in the unique position. I was that person. I got my first vaccination on a Thursday, and the following Wednesday, my husband brought home COVID. So I did not get it in my job. I did not get it in my workplace. I got it from my husband. So all the protocols that the doctor was talking about were implemented. My aide and I, she stayed home for 10 days to quarantine. Anyone in close contact with me stayed home and quarantined. And I have to give it to Clovis. They are very on top of all their protocols and all their testing and their timelines, because I don't want to get anybody sick. I don't want anyone else to get sick. And for those out there living through the vaccine, living through COVID, much rather get the vaccine, don't want to get COVID. So just out there, be safe, because it is a nasty thing to get. But the first vaccine did help me, I think, through the process, because I was already building antibodies.
Thank you, Michelle. That's really great insight. And I have another live question. I'm actually going to direct it to Heather. This is from Sabrina Gonzalez Iran from Fresno. And I'm hoping you might have an answer for this. And the question is, what criteria will be used to decide what children can come back to in-person instruction versus who stays at home? Will preference be given to families with parents who are essential workers? I don't know, Heather, what type of information they've given you guys about the cohorts that Fresno Unified will be having.
It is my understanding that hasn't been determined yet. I have been asking that question for a while now, because originally they were telling us it would only be cohorts of 10 per class period. Now we've got up to 20 because we're going to split them in half. And so that's a question we keep asking. Who's going to identify and how is that going to go? There was some talk at the high school level that it would be students, that were on track to graduate, but we're struggling right now, so we could keep them moving towards graduation. But I do think, and I can't speak to the elementary school numbers, again, my students are polling very low at being comfortable with coming back before next year. So I don't think we're going to run into a situation. I think now Fresno Unified and the teachers, Manuel's gone, but I talked to Manuel yesterday about this. It does seem like with this new model, we'll be able to take about 20 kids per class period. That's a little over 50. I have about 37 kids per class. So I think we're going to be in a position where if you want to come back, it will likely happen, that there will be room. So I do think that students, the big push that I think from the teachers' end that we're starting to conversations around is how do we, reach out to the students that really are struggling in this environment, that and make sure, that they understand that they can, and, communication is going to be big. And again, that's on Fresno Unified to figure out how are we really going to adequately communicate to families, particularly those that we have lost touch with in this past year. But I do think that if a student wants to come back, there's going to be enough students that don't. and aren't comfortable coming back, that we should have room for everybody that is comfortable with coming back, is what I think we're projecting.
Awesome. Thank you so much, Heather.
Can I make
And
one comment
sorry.
about that as
Yeah,
well?
please.
So I think throughout the pandemic, we've really made a point. We, the Fresno County Department of Public Health, have worked closely with our schools. So if any kids were identified as special need children who needed to be on campus, who needed that in-person component of their education, we've worked closely with the schools to make that happen. So you know, we want to be safe, but we want to provide access to in-person learning for our children, particularly those who need it.
Great, thank you. Thank you, Dr. Streffler. So those are all of the questions that we had. Thank you so much to the people who submitted live questions and who also submitted questions beforehand. Thank you to all of our panelists for taking the time to talk to us, and thank you all for joining us today. This has been super informative and insightful. The Ed Lab relies on donations to learn. If you want to learn more about how to donate and to support our work, please visit fresnob.com/edlab. Also, be sure to find us on social media. Our DMs are always open, and we would love to chat, myself and Monica and our higher ed reporter, Ashley. You can follow me on Twitter at Isabel S. Diepa, and you can follow Monica Velez at Monica Velez21 and the Fresno Bee at Fresno Bee. I want to once again give a giant thank you to all of our panelists, and thank you all again and everybody for tuning in. See you next time.